ಇವತ್ತು ವರ್ಲ್ಡ್ ಕ್ಯಾನ್ಸರ್ ಡೇ ಫೆಬ್ರವರಿ 4 ಇನ್ ಅಸೋಸಿಯೇಷನ್ IMA ಮತ್ತು ಅಪೋಲೋ ಕ್ಯಾನ್ಸರ್ ಸೆಂಟರ್ ಅಸೋಸಿಯೇಷನಲ್ಲಿ ನಾವು ಈಗ ಗೌರ್ಮೆಂಟಿಗೆ ಒಂದು ವಿನಂತಿ ಮಾಡ್ಕೊತಾ ಇರೋದೇನು ಅಂತಂದರೆ ಸೊ ಕ್ಯಾನ್ಸರ್ನ ಒಂದು ನೋಟಿಫೈಯಬಲ್ ಡಿಸೀಸ್ ಆಗಿ ಮಾಡಬೇಕು ಅಂತ. ಸೊ ಕ್ಯಾನ್ಸರ್ನ ನೋಟಿಫೈಯಬಲ್ ಡಿಸೀಸ್ ಮಾಡಿದ್ರೆ ಅದರಿಂದ ತುಂಬ ಅನುಕೂಲ ಆಗುತ್ತೆ. ಏನಕ್ಕೆ ಅಂತಂದರೆ ಎಷ್ಟು ಜನ ನಮ್ಮ ಬರ್ಡನ್ ಆಫ್ ಕ್ಯಾನ್ಸರ್ ಎಷ್ಟಿದೆ ಅಂತ ಗೊತ್ತಾಗುತ್ತೆ. ಇದರಿಂದ ಸೊ ಮುಂದೆ ಏನೇನು ಟ್ರೀಟ್ಮೆಂಟ್ ಮಾಡ್ಬೋದು, ಸೊ ಅದ್ರ ಬಗ್ಗೆ ಕ್ಲಿಯರಾಗಿ ಮಾಡ್ಕೊಳ್ಳೋವಂಥದ್ದು, ಯಾವುದೇ ಮುಂದಕ್ಕೆ ಯಾವುದೇ ಉದ್ದೇಶದಿಂದ ಟ್ರೀಟ್ಮೆಂಟ್ ಮಾಡ್ಬೋದು ಮತ್ತು ಇನ್ಫ್ರಾಸ್ಟ್ರಕ್ಚರ್ ಯಾವ ಥರ ಡೆವಲಪ್ಮೆಂಟ್ ಮಾಡಬೇಕು ಅನ್ನೋದು ಗೊತ್ತಾಗುತ್ತೆ. ಸೊ ಎವ್ರಿ ಪೆನ್ನಿ ವಿಚ್ ಈಸ್ ಯೂಸ್ ಶುಡ್ ಡೆಫಿನೆಟ್ಲಿ ಸೇವ್ ದಿ ಬಿಲಿಯನ್ಸ್ ಆಫ್ ಪೀಪಲ್. ಸೊ ಅದಕ್ಕೋಸ್ಕರ ನೋಟಿಫೈ ಮಾಡಬೇಕು ಅಂತ ನಮ್ಮ ಉದ್ದೇಶ.
Cancer Day, that is 4th of February 2025. Today we had a walkathon in the premises of 2 kilometers, making a public awareness about the cancer to the public at large. Then we had many hospitals, like Victoria Hospital, KIMS, Srinivas Hospital. We had a cancer screening program and vaccination administration. This was part of the Indian Medical Association program today. Apart from that, the Apollo Hospital and in association with the IMA Bangalore branch wanted to say this word, especially the government of India, that please notify this cancer as a notifiable disease, which has a lot of advantages to the public at large and the medical fraternity in general. So this is where we had a press conference to have the government of India to notify this cancer, where we can have a larger registry and easy way of treating the patients, and the post-care modalities programs can be worked out. This is where we stand today. Thank you.
For cancer to be designated as a notifiable disease in India. We all know that there's a growing burden of cancer in the country. Every year about 1.4 million cases get diagnosed in the cancer and this in our country, and this number is likely to go up to 1.5 million cases by 2030. The lack of comprehensive cancer data means that we may not fully grasp the true scale of this disease, and unlike other diseases like tuberculosis or COVID, interventions, standardized treatments and allocate resources efficiently. Why should cancer be a notifiable disease? While you will hear our distinguished speakers talk about it, but to give you a broad level idea, first advantage is that it will enhance the data accuracy and ensure that every case is recorded and overall a realistic picture of the cancer's impact across the country is provided. Second is that it is likely to improve treatment protocols with standardized guidelines that help in delivering consistent and equitable cancer care. And last but not the least, there will be a strengthening of research and policy decisions. Once a national cancer registry is made, it will also boost funding and enable more personalized treatment approaches. In 2022, it's important to note that a Parliamentary Standing Committee on Health and Family Welfare recommended that cancer be classified as a notifiable disease. Today, while some states in the country have done it, but many states still haven't notified or
members of the media. Recently, in the budget which was passed on Feb 1st, there was a larger impetus and focus on cancer, adding a couple of life-saving drugs into those which can be in the category of customs free, and then setting the mandate to start 200 cancer daycare centers, plus in the next 3 years an initiative to add at every district hospital cancer centers. But all this will not translate to having a paradigm shift in the way cancer is managed unless you first identify the disease, you understand the cause for it, and you also create, after notification, a registry and do something to reduce the burden of cancer, because you are frankly doing what is called as a fait accompli or a post event, where you actually set up something to keep treating people rather than taking steps to find out ways to reduce the burden of cancer, in some case eradicate it, and in some case to prevent it from vaccination. So one of the things we have taken up well, there's another discussion we could have on the Made in India indigenous cervical vaccine program, and why shouldn't a larger universe of people who can be vaccinated get vaccinated when there are third world countries, as far as one in Rwanda, which has got a vaccine policy for cervical cancer covering their entire population, and developed countries like France and US, which has a cervical cancer policy. Notifying means that we get to know that India has a single policy when it comes to cancer, rather than leaving it to the interpretation and implementation to the state. Currently it's divided. Some states have a voluntary cancer notifiable status, some of them do not have it notified, and some of them are trying to take steps to get it notified. But if we wait for years together, the ICMR recommendation is a decade old, asking it to be notified. If we just keep waiting for it to happen, when you have the ICMR as a governing body from Bangalore, which has given a recommendation saying what are the benefits of getting cancer notified, and having worked on it, I think it's high time that policymakers and lawmakers in this country take it seriously, because it's the same body that they have constituted to actually understand what is the impact of cancer, what is the underlying reason, the burden of cancer, and such a recommendation being brushed aside saying cancer is not a communicable disease can't be considered as its own folly, because a lot of cancers are communicable. To start with, HIV-led cancers, hepatitis B-led cancers, hepatitis C-led cancers, HPV cancers, EBVs, just to name. And I'm sure my colleagues, both the clinicians who are on this forum, can further talk about the growing burden of these virus-led cancers, whether it's buckets, or whether it's cervical or head and neck or penile, or whether it's lymphomas, or each one of them. So there is cancers which are being also formed in society, which are getting alarming increase in the incidence based on the type of communicable cancers that we get to see. That's what.
Welcome here to get the brief of today. Today is the World Cancer Day. Union for International Cancer Control is an international body which is the largest and oldest global organization dedicated to cancer and its eradication there. 4th of February every year has been earmarked to celebrate the World Cancer Day, making it an awareness to the public and to the stakeholders to take charge the whole year what they have progressed to eradicate, control and bring happiness to the cancer patients. The World Cancer Day is an initiative against the cancer where the entire world unites together to fight against the global cancer epidemic. It takes place every year on 4th of February. It encourages cancer prevention, detection and treatment by raising awareness about cancer. It also presses the government around the world to take action against the disease, public awareness, and along the social media help to build more opportunities to expose and global awareness about the impact of this disease on the government and the public health, thus enhancing the cancer services accessibility, reducing incidence in cancer, mortality, and finally the phase is called as myeloma cancer.